have our sales manager, Justina Kopak, and there's her contact information. And we also have our MACRA team, our in-house MACRA team, with Vida Giacomovichute, Payal Patel, and Moon Jung. We also have with us today from Reporting MD, Molly Minahan and Michael Dayant, and of course, MicroWise's CEO, Robert Gabriel. Okay, now that we've covered all of that, we'll go ahead and get started with today's webinar. As you all know, there are major changes going on with Medicare reimbursements. Our structure is changing from volume-based to value-based, and our goal is to help guide you through the proper documentation of quality of care. Today, we'll hear more about the upcoming changes to the reimbursement program from our product manager, Vida, and demonstrating the tools that can be used to help you receive the incentive you deserve. For now, I'll go ahead and hand it over to Robert Gabriel for a quick word. Robert?
Thank you, Amanda. Thank you, everybody. I appreciate joining us with your busy time and at a late time. Thank you for your business. Thank you for all the people that made it to the in-house meeting here. I know the online is more convenient, with avoiding travel and accidents and traffic, but it's always nice to meet people face to face. So I appreciate taking the time and coming in. Just FYI, this meeting is going to be recorded and it will be made public after the meeting is over. I'm doing whatever it takes to make sure you guys are in good shape. I want to make sure that I give you the tools that you need so you don't sell out to a hospital, you don't go sell out to a large group. I'm giving you the same tools that what a large group will do so you can stay independent. If you don't stay independent, you don't have your freedom. I don't have you as a customer. So whatever it takes to keep you independent, I'm here. That's what MicroWise is for. I'm going to hand it back to Vida, and I will be speaking later on and describe some of the programs that we have to help you with MACRA. I don't want you to confuse MACRA with Obamacare. So MACRA has nothing to do with Obamacare. So regardless of Obamacare goes away or not, MACRA is not a part of Obamacare. So don't think that this is going to go away because of the new administration. Okay, without further ado, I'll give it to Vida.
Go ahead and start with our poll questions. I will go ahead and put the first one up here, and we'll give everybody just a couple of seconds to go ahead and vote. How do you think the Trump administration will affect the private medical practices? Most practices think positively. Good. Okay, so we'll go ahead and hand that over to Vida. Thank you so much, Vida.
Thanks, Amanda. Okay, so as Amanda mentioned, the focus of myself and my team is to get familiar with all these programs and inform you so that you can make decisions and how to gear your practice so that you can succeed. We've been immersed in MACRA this year, and we want to make sure that by the end of this workshop, you're well equipped with the tools that you need to be successful during the 2017 reporting year. So let's review what MACRA is. MACRA was put into place to end the Sustainable Growth Rate Act, under which the providers used to get paid under volume and quantity. With MACRA in effect, that changes, and providers are now going to be rewarded based on quality and value rather than quantity. Okay, so the question that oftentimes comes up is who is going to be affected by this? If you are an ambulatory physician, meaning if you are not part of the hospital, if you do see patients on an outpatient basis, if you are not a first-year Medicare participant, and if you bill at least $30,000 in Medicare allowable charges, or see 100 Medicare patients on an annual basis, you are eligible to participate in MACRA and are subject to all of the payment adjustments that come with it. Now, CMS has defined physicians to include medical doctors, doctors of osteopathy. You can see on the left here side under the 2017 label, those also include dental surgeons, dentists, podiatrists. In 2019, or during the first 3 years of the program, MACRA CMS has a statute to expand this list. So starting 2019, you're going to see additional providers added, such as physical therapists, occupational therapists, clinical social workers, and so on. So what is MACRA? MACRA has two pathways. One of them is MIPS, which is your Medicare-based incentive payment system track. It combines your previous meaningful use, physician quality reporting, and value-based modifier incentives, as well as adds a clinical practice improvement activities category. So it merges all of these legacy incentives into what CMS considers to now be one under the MIPS umbrella It simplifies it a little bit in that it reduces the numbers of measures that the providers have to report to, but they are a little bit different. Now, the second pathway to meeting MACRA is your advanced APMs. If you wanted to be part of an advanced APM in 2017, you would have had to have already applied. If you did apply, CMS will notify you by January of 2017 whether or not you qualify. Now, if you do not qualify, or if you did not apply to participate in an advanced APM pathway, you should be prepared to meet MACRA using the MIPS track. And that's going to be about 90% of the providers. So we're going to focus on the MIPS for that reason. As you may have seen, or as I mentioned in the previous slide, MIPS is composed of 4 categories, each of which has different weight to add up to a total composite score of 100. So in 2017, your advancing care information, which replaces what you previously knew as meaningful use, is going to compose 25% of your total composite score. Your improvement activities, which is a new category, is going to be 15% of your total composite score, and your quality, which you previously knew as PQRS, is going to be worth 60% of your total composite score. Now, one thing that I wanted to mention is that these categories do have distinct reporting requirements. And another thing to keep in mind is that for the ACI category, you are required to be on a certified EHR version. So for that part that replaces meaningful use, you should be familiar with what a cert terminology is. You're going to hear that a lot. It is extremely important that you're comfortable with the EHR that you are using. You may also see that one of the MIPS categories I mentioned in the previous slide is missing, and that's your resource and cost category, which was previously known as a value-based modifier. So that's not, in 2017, it bears 0 weight, but come 2018, it is reintroduced at 15%. You will also see that the quality is reduced from 60% to 45% of your total composite score. So what happens if you decide to not participate? Here's where that total composite score comes into play. Based on what it is compiled across those 4 categories, you will qualify to receive either positive, negative, or a neutral payment adjustment. So the payment adjustments start with a performance year of 2017 and start out at 4% and increase and tap out at 9% in 2022. The payment adjustments are always 2 years following the reporting period. So if, for example, you choose to not participate in 2017, in 2019, you will see a 4% adjustment on your Medicare fee-for-service. If you do decide to participate, you can see a positive adjustment, and as I mentioned, that will increase in the coming years. Not all negative. There is also a 10% incentive bonus for those providers that are exceptional performers. So if you do participate, especially in the first few years, because a lot of the providers are still just going to be getting familiar with it, so we recommend that you jump on the bandwagon right now and take advantage of the fact that the performance threshold is probably going to be lower in the first few years because everyone's getting familiar and acclimated, and take this opportunity to do really well and earn a 10% incentive bonus by performing well. So with that being said, I do encourage you to check out a couple of additional resources that CMS has published. If someone has a question about these, we can review on how to use these sites a little bit later on during the Q&A session. With that being said, I just want to mention that MicroWise is growing, as well as with the solutions that we offer our customers. So we're going to hand over this presentation to Amanda for just a few more panel questions, and then.
Thank you so much, Vida. Like Vida said, we do have a few more poll questions, so we'll go ahead and get those set up. Are you currently using an electronic health record system? And we'll go ahead and wait a few seconds for people to get their votes in. Okay. Actually, most people are not. And then our second poll question, what EHR system are you using now? Okay, and then the last poll question, are you currently happy with your EHR? It's the best thing ever, you hate it, take it or leave it, or you don't have one just yet. Okay, it looks like most people don't have EHRs, and those that do are pretty content with it.
Now, an EHR is a great tool for you to use to see how well prepared you are to meet MIPS under the MACRA reporting. Every certified EHR is going to have a built-in meaningful use and PQRS report because those were requirements up until now. Now, a lot of MIPS consist of these previous incentives. So these reports, while they will be updated to report specifically under MACRA, are a very good indication of how well you are prepared as of the current point in time. So for example, one of the reports is displayed here, and I can go ahead and I can select some of the measures to look at, such as electronic prescribing. That, as you saw from the previous slide, remains a category or remains a measure in MIPS. And so I can see that this particular provider is at 80.17% with regards to his e-prescribing. That is a fairly high number. Now, if I look, for example, at some of the other measures, such as patient electronic access provided, I can see that this provider is at 66.84%. A fairly good performance, could be a little bit better. So if the provider is interested in going back and addressing this for the patients that the measure is not met for, these blue links over here are clickable. And so I can click on this 387, for example, in this fraction in the numerator, and that will give me a list of patients that the measure was not met for, so that the provider or the office staff can then go back and address it, or address it the next time the patient comes in. And this applies to all of the measures. Now, this is for the ACI, or what you previously knew as meaningful use category. You can scroll down further on this report, and this will display you the quality measures, which were previously PQRS, as well. So I can, for example, see how well I'm doing with regards to quality measures, depending on which ones are the ones that I will want to use for my MIPS reporting. So same principle here, where if I'm not doing particularly well with any of the measures, I can click on the numerator and I can trickle down to the patients that I did not meet the measure for, and then go back and address it either during the present visit or the next visit, whatever falls into the workflow. So meaningful use and PQRS reports in your currently certified EHR are a very good indication of how well you are prepared to meet MIPS. If you do have a certified EHR that you're currently using, strongly recommend running these. If you do not but are thinking about getting an EHR, these will be a tool that you will be using throughout the MACRA reporting year to see and how well you're doing and how on track you are with each of the measures. This portion will be an overview of how to use one of the CMS websites. It is a great tool for those providers who are going to be reporting to MACRA under the MIPS track. So the website that we're going to be reviewing today is the https://qpp.cms.gov/measures/performance. And once you open up this website, the very first tab that you will see is the performance program performance category. So the program performance category will give you an overview and brief overview and description of the requirements that fall under each category. If you look over on the right-hand side, you will see that for the 2017 performance year, there are 3 categories that compose your total composite score, and quality comes in at 60%. This was previously your physician quality reporting system, or PQRS. Advancing care information, which was previously your meaningful use, is now at 25%, and your improvement activities, which is a new category, are at 15% of the total score for MIPS. So what do you have to do for each category? Well, this is a great website to learn that. The very first category that they review is quality, and this tells you most participants report up to 6 quality measures, including an outcome measure. So you automatically know that to meet this category, you need 6 measures. One of them needs to be an outcome measure. Going down further, the next category is going to be improvement activities. So you have 92 improvement activities to select from, and you must attend, or you must complete, at least 4 improvement activities per provider or per group, depending on how you're reporting, to comply with this category. There is additional information that you should read through, but as a gist, these are the base. So the next category down the row is the advancing care information, and this replaces what was previously known as meaningful use. Now, this category has a base score and then additional scoring that you can earn for performance. So the base score consists of these several measures here. You should be familiar with these if you've done meaningful use before. You already know that you need to conduct security risk assessment, e-prescribing, provide patient access, and summaries as referrals to different providers, and then accept summaries of care if different providers send patients your way. So this is your base score, and then on top of that you can get additional scoring if you have an interface with an immunizations registry or some sort of a public health agency, and so forth. The last category in MIPS in 2017 is cost and resource value-based, cost and resource category, which replaces what you previously knew as a value-based modifier. In 2017, this is a 0 weight, so we're not going to focus on that category just yet. Now that you know what each category entails, the next step is to go back to the top of this website and look at the quality measures. And that is your first performance category in MIPS. Again, it is worth 60% of your total composite score. So quality measures category, again, will give you brief instructions and introduction into what the requirements are. But the best way to really look at this category is scroll down to where the filters are. Now you see that you have 271 measures available. So first what you will want to do is to filter it out by specialty. From the specialty measure filter in the far right, select the specialty that applies. So for example, we will pick cardiology, and you will see that your measure score is now reduced to 20. So from here on now, I can go ahead and select whether I want to look just at high priority measures or at both high and low priority measures. So in this case, I will go ahead and select yes, I want to look just at the high priority measures, and now I'm reduced from 20 measures down to 7. From these 7, you can pick the ones that apply to your practice or that you see your practice being able to incorporate into their workflow. So if you wanted to find out a little bit more about each measure, just click on it, and it will give you additional information into what exactly that measure is composed of. Once ready and identified the measures that you would potentially like to report on, add them, and what you will see is on the right-hand side, CMS has given you the shopping cart looking item, so you will see those measures added into here. So we need 6 measures. I'll go ahead and add 3 high weight measures, and then I will go back to my high weight filter, deselect that, select no for standard measures, and out of these add 3 more. And you can add more than 3 and then sit down and review them with your staff and identify the ones that you're certainly going to be reporting on. It is always a good idea to perhaps try and report on a few more just in case you fall short of any. You always have a backup. Once you have your measures identified and in your shopping cart, you will see a button that says Download CSV. Click on that, and this will export the measures that you have selected into an Excel spreadsheet. So I can see that there's an Excel spreadsheet at the very bottom now. I will go ahead and open that up, and this will give you a little bit more information into each of the measures that you have identified. So here are the measures I've selected, and if I just expand each cell, I can see what the measure is composed of, and most importantly, I can see what are the methods that I can use to report this particular measure. Whether it's something I can send through claims, in which case you would want to find out what are the codes that you need to be adding to your claims, whether it's something I can send through an EHR or perhaps even a registry. So I'm going to close out of this spreadsheet. The next category you will want to look at is your advancing care information. Again, up at the very top, I'll switch to the advancing care information tab. The very beginning of it will give you some introduction about the advancing care information category, as well as the instructions on how you should use this particular portion of the page. And then what you can do is, in addition to the already required base core measures, you can go ahead and add ones that you're going to want to do for performance. So I will, for example, select perhaps providing patient-specific education and add that to my shopping cart. And same idea as with the quality measures, you will see those populate over on the right-hand side. So you will go ahead and select to 9 measures, and then you can go ahead and export them into a CSV again. And this will again give you some additional information on that particular measure. So it'll tell you that patient-specific education could give you up to 10% of your total score for this particular ACI category. Immunization registries could weigh in from anywhere from 0 to 10. E-prescribing is giving you 0 because that is a base score or a base measure, so you have to report that either way. And then patient-provided access will give you up to 10% of your ACI score. So that is your ACI category. And then the last category to look at is your clinical practice improvement activities. So you have, if you scroll down, you will see you have over 92 activities to report on. You can select 4. Some of them do have to be high weighing activities. So in the activity weighing filter over on the right-hand side, you will go ahead and select that drop-down and filter down to highway activities. It reduces the number of activities from 92 to just 14, and then out of those 14, select ones that you could potentially incorporate into your practice. Perhaps participation in a systematic anticoagulation program, or whatever it is that applies. So I'll just pick any at this moment. And then I will go back to my filter and filter to medium weight activities. Now this shows you all of the activities. If you're looking for ones in particular categories, you can also filter it out by category. So if I click on this and I'm particularly interested into behavioral and mental health activities, I can go ahead and select that filter. If I want patient safety and practice assessment, I can pick that. Expanded practice access is probably going to be one of the popular ones. So you can use telehealth if I perhaps want to use that. And you can look through these and identify and pick ones that you think you could incorporate into your workflow. So I have 4 here. I will now do the same thing as I did for the quality and the ACI categories. I will download it to a CSV or an Excel spreadsheet, and here are the activities that I've selected and some additional information on each. So I do highly encourage everybody to take a look at this website and play around with it and at least see what measures are out there so that you can try and puzzle together what it is that you could potentially report on as a practice.
Have you ever reported on meaningful use or PQRS? Looks like a good amount of people have. Did you receive or will you be receiving Medicare penalties on your claims in 2016 or 2017? Okay, we'll give you a couple more seconds. Oh, so there's a fair amount that are receiving penalties. I'm going to hand it back to Robert for some closing statements before we enter into our Q&A session.
The first thing I want to show you is the handout. So if, in the dashboard, you should have a section for handout, and you have 2 handout. So I'm going to open one of the handout now. And the first one I want to open is the revenue flyer. So I know a majority of our customers are actually billing company. So it's not really competing with my billing company, but we can work together. So this is the revenue cycle management, because if things are getting so complicated, and I hate seeing physicians are getting bought out by hospitals or by larger group because of the complication. So I developed this here where, and of course, depending on the specialty, on the volume, those are our average number. So for example, the end-to-end RCM and the end-to-end package is really giving you all the EMR tools, all the practice management, the scheduling, the services, the MACRA. We're bundling also the report dashboard that you're seeing as a part of our service. So this is the end-to-end package, includes everything, so you don't have to sell to a larger group or to a hospital, because you can't make it anymore in today's economy. So the other thing that we're offering, if you're happy with what you have, if you have your in-house billing and everything is fine, then you can have one of the other packages, or you can also sign up with just a straight. We've been always offering PQRS and meaningful use service. So we're going to replace that with MACRA. And this year, depending on what software you have, we will bundle in that dashboard that you're seeing that will help us and help you, so you can monitored on a daily basis, and we will also, as a part of our service, we will monitor that for you and make sure that you are doing good. The other things in the handout is the PDF of today's seminar. So this is a PDF which has all these slides from today. And on the slide, there will be a link here to the MIPS APM. So Vida, you wanna discuss that?
Yeah, so one of the very great tools that CMS actually published is this link for MIPS. Because like I said, most of the providers are going to be reporting on MIPS. I recommend that you log into this website and monitor through and kind of skim through it. So up at the very top, you're going to see program performance, quality measures, which is your quality category, advancing care information, which is your ACI category that replaced meaningful use, and your improvement activities. So a lot of the questions is, well, how do I know what measures to report on? So let's take a look at, for example, the quality measures category. If you scroll down, you're going to see an option to filter this out. So for example, let's start with a specialty measure set. So from the drop down, I'm going to go ahead and, just for the sake of this presentation, select cardiology, for example. You're going to see that that reduces the number of your measures down to 20. Then, as Molly mentioned, if you decide you want to participate, or if you report on several high performance measures or high priority measures, you can trickle it down to that. So for example, if I go ahead and select the yes, I want to select only high priority measures first, you're going to see that that now reduces your measure number to 7. So from these 7 available measures, what you can do next is select which ones you want to do. So you can add them, and what you're going to see is on the right hand side, CMS is giving you this little shopping cart. You're going to see those measures added there. So for example, let's say I'm going to select care plan, I'm going to select cardiac stress imaging, and then I'm going to go back to the top and change from high priority to now just the low priority measure, and go ahead and select a couple of low priority measures as well. Oops, sorry. I'm getting familiar with Robert's mouse, so forgive me for going up and down. Okay, so here I am. I have all these measures that I have selected. The next thing that you're going to want to do is download to a CVS. So I don't believe that Robert has Excel on here. What that will do is it will export your selections to an Excel spreadsheet, and that's going to show you what are the methods that you can use to report this particular measure, what exactly is in the numerator and the denominator criteria. And what we recommend is go through these, sit down with your practice and your staff, and discuss which ones are you going to be able to do. So you can do the same thing for the ACI category. If you just switch the filter up at the top to the advancing care information, same exact method, go down to the filters, filter this out a little bit, and you'll be able to select which measures you want to report on.
And Vida, what if your specialty isn't on that drop-down list?
You'd really just have to look through what's available and pick out of that. I will say, however, that 80% of the quality measures are geared towards specialties. So CMS did really take into consideration that a lot of the provider complaints were that, the measures that were available weren't necessarily specialty specific. So 80% of them that are available are geared towards specialties. So you should be able to find something and mix and match that you should be able to report on.
Now, depending on if you're one of our customers for the EMR, if you're using one of our EMR, we are hosting seminars specific to each EMR, show you how to comply. That's included as a part of your service. Then we also have the service that you're familiar with that we always had for the meaningful use and MACRA, where we meaningful use and PQRS, that we actually hold your hand and make sure that you're doing everything. We did the assessment for the security assessment for your network and all of that. So that it's going to be replaced with the MACRA service, and we're going to be bundling the dashboard that you've seen with the reports, depending on what software you are using with us. Then we're going to discuss later is what are the options for somebody that wants to do it on their own or don't have an EMR and don't want to have an EMR because they're a few years from retirement. for now is I want to open the floor for Q&A. Then I'll be showing you a few more other things. And Amanda, is there another question before we go to Q&A?
Yep, we're going to just do 2 quick more poll questions before we open up the floor.
All right, so we have a big chunk where they're retiring within 2 to 5 years, and if you're not ready to have an EMR, we will have an alternative for you, and we'll just caution you about that alternative before we show it to you. Okay, so let's do the next question. And 42% thinks they can do it, and the portion that they're not sure of what to do, because I understand it could be complicated, and it depends. You're not sure if your specialty need to comply or not. So we can take that one-on-one. So we can schedule a private consultation where we can advise you on what you need to do and how you should get started. Now
okay,
go ahead, Amanda.
Our first question is from Jennifer. She says, I've never done PQRS and I'm receiving penalty. Physical therapy is not included at this moment for MACRA. Will I still receive a penalty?
You will receive so not for MACRA, you will receive a penalty for PQRS, and the penalty that you are receiving is for not participating in 2015. So that is what your adjustments are going to be reflecting in 2017. As of right now, PT is not going to be added or is not going to be eligible for MACRA until 2019. I do, however, recommend that you check in with CMS every now and then because they do change things fairly frequently. So I wouldn't be surprised if that PT specialty was added a little bit before 2019. As of the way it stands right now, no, you wouldn't be subject until 2019.
Now, at any point, would people have double penalties from PQRS and MACRA, or that's a 2-year overlap?
So it's a 2-year overlap, which means if you didn't or aren't going to participate in PQRS in 2016, then you're going to see payment adjustments in 2018. The payment adjustments for MACRA won't start until 2019.
Okay, so they're never going to have both double penalties.
Right.
Okay.
Okay, we have a few hands that are raised, so I'm going to go ahead and unmute them. First, we have Steve Poling.
Hello.
You're unmuted, so we can hear you now.
Okay. You talking to me? My name is Steve, Dr. Steve.
Hi there.
I'm a podiatrist in New Jersey. I've practiced 30 years. I have a small office, a part-time office. All those things that fit into categories: blood pressure, smoking cessation. I do for operating on bone and vascular, and you got vascular problems. But all the other things, legally, I don't even know I can physically be allowed to take blood pressure, even though I'm more than qualified. I mean, none of these things. You say there's specific seminars coming up for podiatry. That's going to be important for me. And also, I know through the MR, and the gentleman said there are going to be alternatives. But what particularly for podiatry has to be done to qualify for these points or just full reimbursement?
Hi, Dr. Steve. So the first thing you're going to want to do is comply with the ACI category. That's going to be important. They did reduce a number of ACI measures. They're a little bit more general now, such as referrals and patient portal and e-prescribing. So that's going to be a little bit easier to meet now. Vitals and things like that aren't necessarily part of it anymore. With regards to what you can do for the quality category, we really would just have to sit down and take a look at, out of the available measures, what you could be doing. I'm sure out of the measures that CMS has published, we will be able to find something that is more practice specific for you than it has been in the past. It is just a matter of sitting down and selecting the measures that you're going to be reporting on. So I do hear that if you've done meaningful use or PQRS in the past, a lot of those things didn't necessarily pertain to the practice and you did them just to get credit. It no longer is an all or none reporting category either. So before, for meaningful use, if you failed one measure, you failed the entire incentive. It's not like that anymore. So that if you don't meet particular measures, you can still pass MACRA. But the measures are changed. They've reduced them a lot. So I do think that it's going to be a little bit easier for you to meet it this time around than it was before.
Thanks, Vida. We have another question from Lorraine. Lorraine, I've gone ahead and unmuted you.
Basically, I had the same question as Dr. Poling did, so you kind of answered it for me already. Thank you.
Okay, thanks. And let's see, we have a question from Jennifer Vinicchio. She says, will they do away with her penalty now since PQRS is obsolete?
No, so if you didn't participate in 2015, the penalty is still going to be applied in 2017. If you didn't participate or aren't going to participate in 2016, you are going to see payment adjustments reflect in 2018. So PQRS penalties are not going away. MACRA penalties aren't going to come into effect until 2019. So to answer that question, you are still going to be subject to PQRS penalties if you didn't participate.
Our next question says, on the handout, you state that if the doctor sees at least 100 Medicare patients annually, is that number based on actual people or visits? Some patients come in more than once a year, just to be clear.
From my understanding, it is people. It's not encounters. It's Medicare patients.
So regardless of the came or not.
Regardless of how many times that patient visits your office, correct?
But they had to come in within that year.
Correct.
So it's not over all the population. Somebody's, has not come in the whole year. It's the people that came in.
Our next question comes from Jules. Will MACRA/MIPS require a certified medical assistant to enter CPOE?
CPOE is actually no longer part of MACRA, so that particular objective is going to be removed.
Okay, it looks like Dr. Pauling has another question, so I'm going to go ahead and unmute him. Dr. Pauling?
Sorry, getting back to what you just answered the last question. So the present penalties are standing until 2019. Then they're expunged, and then the new penalty of, let's say, 4% goes in. It's not the 4% plus whatever I'm getting charged now, correct?
So the penalties are always 2 years after the reporting period. So the last reporting period for PQRS is 2016, which means the last time you're going to see PQRS penalties are 2018. Now MACRA starts in 2017, which means you're going to start seeing MACRA either penalties or incentives in 2019. So 2018 is going to be the last time you see meaningful use or PQRS penalties, and then in 2019 you're going to start seeing MACRA adjustments.
And they are what percent now? I'm sorry, they're what percent now? 2% or something like that?
Correct.
Depending
for PQRS.
Yeah, if you don't report in 2017, 2% penalty in 2019. Then the penalty keeps going up. 4%, I'm sorry, 4%. Then it would keep going up until it reaches 9% by reporting of 2019?
Correct.
Okay.
Okay, so what happened after 2019?
So after 2019, the penalties increase. If we go back to the webinar slides, you're going to see that by 2019, if you don't report in 2020, or by 2020, excuse me, if you don't report in 2022, you're going to see the payment adjustments rise up to 9%. So here is that slide. It's always 2 years in advance. So 2017 payment adjustments will reflect in 2019 and will be up to 4%. So this keeps increasing, as you can see. And if you decide to, for example, not report in 2020, by 2022, you're going to see a 9% adjustment. Now, this could be a positive adjustment if you do report. If you do exceptionally well, it could be not just a 9% incentive, but a 19% incentive. So it really depends on.
So this is a zero sum. So what does that mean? If Medicare is taking money away from somebody, they're giving it to somebody else. At the end of the day, Medicare will wind up with a zero gain or loss. The money is circulating between the doctors that are participating with Medicare. So if you don't take the money, another physician is taking the money as a bonus.
Did that answer your question, Dr. Pauling?
I was concerned it was going to be cumulative, let's say 2% plus 4%, but it's not. It's when that ends, the other one kicks in. So it's not a cumulative, the old system and the new system. I got it.
Correct.
Okay, we have a few more questions coming in. Can you help with MACRA/MIPS compliance if we have different EHR, like what are the different support options for supporting another EHR?
Let's take that offline. I can't answer it because there's 5,000 different EMRs out there. So let's take that offline and we'll
What is VBM?
VBM stands for value-based modifier. So if you submitted to PQRS in 2015 or are going to in 2016, you have a performance score, which means if you report, that you met the measure for 81% of your population, that's a high performance versus someone who has a lower performance for that measure. So value-based modifier is based off of that. And so if your performance is low, you're receiving a value-based modifier penalties. And that, again, CMS establishes kind of a benchmark from previous reporting years, and so they decide what the threshold should be, and if you're above or below it, that's how they assign value-based modifier penalties.
For CPIA compliance, for example, extended hours and phone support, do we have to log it in the EHR?
You do want to make sure, because CPIA is so broad and CMS hasn't yet determined what you're going to be able to report via the EHR or the registry. You do want to make sure that you have proper documentation and that in case you get audited, you can supply that documentation. So you don't just want to say that you did it. You want to make sure that if someone asked how, you can prove it.
And we have a question from Jules. Do MACRA and MIPS apply to a reference laboratory that is doing biopsies, pap smears, blood work, urine, microbiology cultures, etc.?
What are the credentials of the providers in those laboratories? Are they MDs, DOs?
Okay, this is a question from Stephen Chang. I've gone ahead and unmuted you. You can elaborate a little bit more.
Sure, thank you. So the ones who are reading the pap smears might be physicians, or they might be cytotechnologists, just depending on whether it needs to go to them or not. The biopsies would be read by a physician, and then the other work, which is the blood work, the urine, and microbiology, that stuff is not done by a physician, that's done by a technologist.
So the technologists would not be included in 2017. Now, do the physicians see patients, or do they just present it with the reports?
They see slides, and they read the slides, so whether it's a pap smear or a biopsy.
Molly, do you have an answer for this, Molly?
Sorry, I was unmuting. I think you guys are getting pretty close. I mean, in the end, if they're MDs, then they need to report under MIPS, but obviously in some cases they're not going to meet some of the threshold information. I was just looking specifically at some of my notes, but I think what it comes back down to is if they're billing Medicare, then they need to report under MIPS as long as they meet the threshold.
Now, to add on to what Molly says, CMS did say that if, for example, providers aren't able to meet measures in one particular category, they will redistribute that weight to a different category. So, for example, for ACI, which was previously meaningful use, if they see that you're not able to meet those particular measures, they're going to take whatever the percentage of that category was and redistribute it amongst the remaining categories so that you can still get a fair scoring.
Okay, thank you.
Lorraine, I've gone ahead and unmuted you.
Are you able to help us to report if we do not use an EMR?
Yeah, we're going to show you. We're going to show you that next. We're going to show you a solution, but before we show it to you, Vida, you want to talk about the side effect?
So the only downside with reporting is that you're essentially running through a checklist of things that you have done or have not done. If you're not going to be using an EHR, it becomes a lot harder to track certain measures such as the ACI category, which was previously meaningful use. So for anyone who has done it in the past, you know that all of those measures are captured in the EHR. So if you're not going to be using an EHR, it essentially becomes a checklist of, yes, I have done this, no, I have not done this. For example, one of the measures is e-prescribing. You're going to have to be responsible for tracking how many patients did you see in the reporting period that were eligible for e-prescribing, how many of those patients did you send prescriptions for. So it becomes a lot of manual work, and you are going to have to back those numbers up because they can audit you for up to 6 years after you report. So if they come back at any given point within those 6 years and say, I want to see where you and how you got those numbers, you're going to have to back that information up. And without an EHR, it becomes very difficult to do. So while you do have the option to still report, just keep in mind that you have to be extremely diligent about documenting it. It is a lot more difficult to do.
So
okay, thank you.
Yes, we have some more questions. For billing done other than EHR, what has to be done to be compliant with MACRA or MIPS?
Meaning for if you chose to report your quality measures via claims?
I'm going to go ahead and unmute Adil, and you can clarify or elaborate more on that.
So if billing is done other than EHR, is there something that we can do to be compliant, like any modifiers or G codes and stuff like that?
Each specific measure that you select is going to have its own code that you're going to have to submit to Medicare. So if you do decide that you want to do, specifically the quality category through claims, someone has to be responsible to making sure that, one, the measures were actually performed for the patient, and then two, the codes for those measures are reflected in the claims that you send out to Medicare.
I see. Okay, thank you.
Okay, Justina, do we have any questions in the conference room?
We're unmuted. Can you hear us?
Yes, we can.
I don't think we have any questions here.
Okay, we have a few more that came in. How many MACRA or MIPS measures do we have to be compliant with?
So every category has different measures. For a quality category, for example, your measure number is reduced from 9 down to 6. You also no longer have the 3-domain requirement. Now, a CPIA category depends on the size of your practice. So it really depends for each category. We do have webinars that we've posted on that too that kind of break down how each category is scored and what are the requirements under each. So maybe, Robert, we can show where the previous webinars are.
So the previous webinars, if you go to, sometimes it's included with the invitation, and you can go directly to our website. So it depends on what product you have. So if you click on the product, then you click on the training icon. Then all the way at the bottom here, there's takes you to the training icon. And so this is all, this is Medisoft related, and there's Lytec related. Then the MACRA related is actually, it was a part of the MACRA meetings that we did. So let me show you that. So if you go to the main event, they go to the event, and the MACRA meetings, they pass. So if I go to last month, I will put a link on today's seminar, but if you go to, let's say, the MACRA meetings that we did in November, if you click on any of them, I guess they were not up. Okay, so this is one of the MACRA. So this is the different tracks for MACRA. So if you click on any one of the MACRA meetings, all the way at the bottom here, there's the MicroWise TV. If you click on that, that will take you to a different channel, and this is the EMR EHR regulatory channel, and that has all the MACRA seminars that we posted.
So just to kind of add on to what Robert said, if you look at the MACRA available webinars, we did a series of these. So you're going to see 4 of them. One is MACRA 101. It kind of talks about MACRA as a whole in a very broad sense, the way we did today. Then there's a second webinar that talks about MIPS specifically. Then we have the MACRA APMs track, and then MACRA there's a MACRA Q&A somewhere here. Yeah. So the one you want to look at for the scoring categories is going to be your MIPS track. Another thing, like I said before, is I would highly recommend utilizing these resources, because this will not only tell you what the scoring needs to be, but it will also tell you or help you pick the items that you need to report on. So if you want to go back to performance measures, here's your, if you look up, this will give you the information that you need. Like, for example, for groups that are 15 or lower, or 15 or larger. So I do recommend scrolling through this website along with the webinar that we've done in the past, and that'll give you a good idea of what you need to report on.
And of course, if you sign up for our services, we will do this with you, holding your hand. If you have Medisoft Clinical or Lytec MD or Greenway, we'll be showing this at no charge for all our customers. But if you want to do it one-on-one, then you can sign up for the service. If you sign up for the service, we do include the dashboard that you've seen today. Any more questions, Amanda?
We have one last question before we close out for the evening. Are certified medical assistants required for any type of data entry, order entry, or diagnostic entries with MIPS?
No, so I mean, MIPS, just like MACRA and meaningful use was, it's going to be an office effort. So, some things are going to be done by the providers. Some things are done entirely by providers. Those offices that are a little bit smaller and don't have medical assistants to enter information, the provider does everything. Now, there are offices where the medical assistant is available and maybe will help the provider enter specific information. But no, there's nothing specifically that you need, a medical assistant for. It just may make your life a little bit.
So just to clarify, she has a medical assistant. Does that medical assistant have to do that?
No.
Or you're saying it's okay.
If the medical assistant is not credentialed as, a physician's assistant or a nurse practitioner, no. If it's, if they don't have specific credentials.
They're not billing.
We have another question. If you only provide pre-admission service for patients who have mental disorders via telemedicine before they are admitted by the facility, you don't have EHR either, is it still possible for you to participate in MIPS?
What are the credentials of the provider?
Let me see if I can unmute Chelsea.
Hello?
Hi, we can hear you.
Okay. I'm sorry, can you say your questions again? Because I was kind of cut out before.
Chelsea, what are the provider credentials? Sorry, ma'am.
Hello?
What specialty is the practice?
It's not a practice. It's more like a provider association, physician associations. We provide the service to the facility, but we ourselves is not a practical hospital or clinic.
And so, let me just understand this. You guys bill under a specific MPI for the provider in question to Medicare?
Yes.
Okay, and you have more than $30,000 in claims, and you see more than 100 Medicare patients annually?
Yes.
Okay.
Yes.
So then you would have to report to MIPS. Now, telemedicine is going to qualify for your CPIA category. There are other categories in quality, or there are other measures in quality and the ACI that you would need to meet. So I think we'd really just have to have more of a broader discussion about how it is and what it is that you're charting currently. But if with regards to telemedicine, that's going to qualify for your practice improvements category. How do you currently chart patient information? Where do you put that in?
We don't really have like EHR things. We have kind of our system or platform that we put all the data together, but it's not anything certified or official.
Okay. What I would recommend doing is logging on to the website that I posted the links for the MIPS that I posted before on the CMS website. At the very top of that page, you're going to see there are ACI, quality, CPAA categories. Look through those. That will give you an idea of what it is that you're supposed to be reporting on.
So on the right hand side, when you click the arrow down to the you're going to see two handouts, both PDF. So one is MACRA, one is revenue flyer, which is revenue cycle management. So when you open this is what VITA is talking about.
Second to last slide. And this one.
This one right here.
So the MIPS.
So you cannot click on it because this is a PDF, so you need to copy and paste it into your browser.
So if you want to copy, you can quickly show how to navigate that.
So if I copy this, actually it's clickable.
Okay. So if you access this, like for example, advancing care information, quality measures, this is posted by CMS. This is actually one of the most useful sites on their page. So for example, for quality measures, what you can do is scroll down and try to filter this. So for example, select your specialty in here. So whatever your specialty is or whatever it falls under. So let's do the first one. Then what you're going to want to do is you are required, so you'll see this list automatically shrink down to the specialty. Then what you're going to see is the next item I would suggest doing is yes or no for high priority measures. Now, you'd need to know the reporting requirements, but you are required to have several high priority measures. So let's say yes, you want to filter down to high priority measures. That's going to shrink it down even more to now show only 8 measures. What you can do is select the ones you want to report that you think would be applicable. It's not, you don't have to make the full decision right now. Add anything that applies to you. And what you're going to see is CMS is going to start putting for you in this shopping cart over on the right-hand side here. When you're done selecting your measures, you can download this to a CVS, and this is going to export. I don't think Robert has the settings on this computer, but this is going to export into an Excel spreadsheet that's going to tell you what that measure consists of. It's going to tell you how you can report to it. So, if you are concerned about the EHR for this particular category, there are some measures that you will be able to report via registry. Again, registries are an additional charge, and you have to make sure that they're able to extract the information from the way that you're putting it in. But it'll give you an idea of the measures that you want to do, as well as what are the methods that you could potentially use to report them. With regards to the ACI category, I will say that's going to be a little bit harder because most of those measures are typically put into the EHR.
I don't want to sound like infomercial, but if you go with our MACRA services, we'll be holding your hands. We want to make sure that you guys are doing it right and you don't face any penalties and try to do the best and maybe get bonuses, not just avoiding penalties. Next question.
Okay, that looks to be it for the questions. Erin Murphy?
Hello.
Hi there.
Hi, thank you. We just had a question. We didn't see occupational therapy listed as one of the specialties to choose to see if we can look at these measures. So what would we do?
So occupational therapy comes into play in 2019. So you guys don't have to do MIPS so if we bring up the PowerPoint, I'll show you one of the, let's keep scrolling. This one here. So if you see over on the left-hand side here, occupational therapy is starting to come into play in 2019.
Okay, but we got a letter getting the decreased payment for next year.
So you're getting the decrease in payments for PQRS.
Yes.
Not MACRA.
It's not MACRA.
It happened already. When is it?
2015. So
2015.
Yes, one of the MACRA categories is PQRS, but as a whole under MACRA, you don't have to report it. So for 2015, these were, up until now, these were all separate. So you're getting penalized for the fact that you didn't report to PQRS in 2015, and so you're now seeing penalties applied to your claims 2 years down the line in 2017.
Now, could that be tracked through PHOTO, the functional outcome tool?
Patient photos?
Yes, where we get the G codes, and that's what we've been submitting, and that's one measure that we have not missed. So I'm just trying to figure out.
So it depends. So PQRS had different requirements. They needed 9 measures. Those measures needed to be spread across 3 different domains. One of them had to be cross-cutting. So even if you reported through claims, if you didn't meet the specific demands that they had, like had the measures spread out across 3 domains and whatnot, then you'd still get the penalty.
Okay, so we're dealing with 2 different things, PQRS and MACRA now.
Right. PQRS becomes part of MACRA, but for the 2017 reporting year, they've left occupational therapists out. So you don't have to do it in 2017.
Okay, thank you.
So, Justina, I haven't heard from you. I asked you to mute your phone, and we haven't heard anymore. Is there any questions in the conference room? Okay,
and we have one more question. Is chiropractic listed under the specialty list?
Chiropractors should be, yes, physical therapists are excluded, occupational therapists are excluded. I do believe
excluded till 2019.
Yeah, chiropractors are considered quote unquote physicians for 2017 and are eligible to be reported. The only thing is that if chiropractors aren't billing $30,000 or more in Medicare professional covered services and aren't taking care of more than 100 Medicare Part B patients, then they are not considered MIPS eligible. They're not participating. But if they are meeting those requirements, then yes, they are MIPS eligible for 2017.
So did that number change? Because I remember it used to be 10.
They changed it with the final rule, yeah.
All right, they didn't tell me. Okay. Okay, so it used to be 10, now it's 30.
30, but it's or. It used to be and. So it used to be 10,000 and at least 100 patients. Now it's or. So 30,000
So it's 30,000 or 100 patients.
Mhm.
100 patient Medicare patients
Right.
that were seen.
Correct.
Okay.
So actually, so it's $30,000 if you bill either $30,000 or if you bill less than $30,000 or you see less than 100 patients, then you are not MIPS eligible. If you meet both of those, then you are MIPS eligible. They wanted to give a little bit more flexibility for smaller doc practices for the 2017 transition year, and I think that will change again in future years, but that's the setup for 2017.
So Nancy, I think that it was Nancy from a chiropractor, and they see they do $15,000 per year Medicare. So I guess she's already exempt, right?
Do they see more than 100 patients?
Okay, so if the 15,000 comes from more than 100 patients, then you will be subject to a penalty. But if they're coming from less than 100 patients, then you're not subject to a penalty. And I remember somebody asked me a question over the email and said, is that dollar amount of how much you bill or how much you collect? Molly, do you know the answer? Okay. Molly? All right, I guess.
I was muted. Sorry. It's allowable charges. So it's what CMS is covering. So that's what's used. The allowable charges.
So that's so that's include the deductible and the co-insurance and all of that. So it's not just how much money you collect from Medicare. It's including the allowed amount.
Yes.
Okay.
Yes.
Thank you. Thank you.
Okay. We have somebody with a raised hand. Priya, do you have a question? Priya, it looks like you also had some follow-up questions about the chiropractors. Okay, I guess we'll move on. I don't see any more questions.
Okay. All right.
So we'll just follow up. Erin has a question. Hang on, Erin. Let's unmute you. Okay, Erin, go ahead.
Regarding the PQRS again, I'm just talking with one of the owners again, and since 2017 is right around the corner with MACRA, it's included, the PQRS is included with MACRA, like you said. Would that be included in the note template in the EHR, and that we wouldn't have to do our own PQRS on the side?
So PQRS goes away in 2017.
Okay.
Now, if you did want to report to the MIPS category in the future years when you are eligible, it really depends on where, how you're going to be reporting to those categories. So if you're going to be reporting through the HR, we need to make sure that however you're charting them, whether it's in the notes or, in the structured section somewhere, that the reports we're running are going to be able to extract it. So you have, when you're thinking about setting your EHR up, it's not just, yes, my provider does make a note of this in the note. You have to work with your vendor to really make sure that that information is being put where it's supposed to be put in, because if you're just charting it in the note and the system doesn't know to look there, then, there's no way to track it back.
Okay. All right. Thank you.
Thanks, Erin. And Priya wrote in, are chiropractors allowed to refer to themselves as physicians?
Yes, I think we just answered that question a few seconds ago.
Yes, they are physicians.
Okay, that looks to be the end of the questions, so we'll just finish up with the last two poll questions. How many years away from retirement is the average physician in your practice? 1 to 5 years, 5 to 10, or over 10 years? And most are over 10 years, it looks like. And then the last poll, after what you have seen today, will you be participating in MACRA next year? Okay, well, we want to thank you all for taking the time today to join us for our webinar. I know that it's a pretty big topic that we're undertaking, and you may come up with more questions.
This brings us to the closing. I want to thank you so much, and for your business, for attending, and as a thank you, I'm going to be sending you a link to my ebook. how to lose your practice, your medical practice in 10 ways. And it's an easy read. It's about 32 pages, and it's really, you know, lessons learned from other practices that they sold to hospitals or to larger groups. And luckily, we start to see some of them are coming back. But I just want to make sure that you doesn't happen to you. And I'm here to help you. We offer all wider range of services to help you, so not to be selling out to a hospital or a larger group. If you are a billing company, and majority of our customers are billing company, I can offer you the same services that I offer to, and we can partner together to do this service to our clients, because when you lose a customer, I lose a portion of a customer. So without further ado, I want to thank you so much for attending. I want to thank you so much for your business. And I should be finishing editing the this video by the weekend. So I'm going to be combining some of the Q&A from the morning meeting, so you can have all the Q&A together, because a lot of good questions were asked this morning, and good questions were asked today. So we want to combine them together. And thank you so much, and I'll see you around.